I'm by the River Thames, not far from where you are now, and I'd like to draw some water from the river. Many of you would be shocked if I use this water as a drink. But many people in my country, children and elderly people, use this type of water for their domestic use. But if I used it as a drink now, you might as well think I'm insane. But I emphasize the point that this is the type of water which is used in my country as a source of, for drinking and other domestic uses. Thank you.
Malawi is one of the poorest countries in Africa. 90% of its population live in rural areas like this, where clean water is hard to find. For the people of Matakane village in central Malawi, the situation is desperate. The only water sources are either a river 20 kilometers away or a disease-ridden open well. Water-related diseases such as cholera and typhoid are common killers here. 1 child in 8 will die before their 5th birthday. Adults can expect to live little more than 40 years. Boyce Nyirenda is WaterAid's Programme Manager in Salima, a country district about 3 hours' drive from the capital city. Much of Boyce's time is spent contacting the most vulnerable and isolated communities who need WaterAid's help.
When you go into a village for the first time, people are usually suspicious of you. They do not know the business you're going into the community for. And so, to start up very easily in the community, you play with the kids, all right? And when you play with the kids, the mothers and the fathers lose their suspicion very easily, and they get interested in you and say, well, who is this visitor playing with our children in this village? But one of the issues that you should be very quick to spot here is that communities don't really have access to potable water. They do not have access to effective sanitation.
The poorest communities are often the hardest to find. Located far from the major roads, they lack the capacity to stand up and make themselves heard. WaterAid's task has not been made easier by local government. In Malawi, district authorities are overstretched and underfunded. Few records are kept on where the water points are or how many have been built.
I think the problem that we encountered was when we got information, when we tried to get information from the district authorities regarding the status of access to potable water and effective sanitation, there's absolutely no one that had all the information.
WaterAid's solution was to employ teams of mobile researchers to map the distribution of Malawi's existing water points. Using a notepad and GPS, a satellite positioning system, researchers can pinpoint a water source to within 9 meters. This information is then added to a population map so that the ratio of water points to people can be accurately calculated.
Now, until you have got everything on one map and you can look at it and study it, it's only then you can actually work out where the unserved areas are and the unserved communities are. And then you can target the work, WaterAid's work, and you try and influence other major donors as well to always also use these maps to target the unserved people within the unserved communities.
The Salima District Assembly and other donors are now using the GPS maps to help determine where to install new water points. Other WaterAid country programmes and agencies internationally are also planning to adopt similar mapping systems. Once underserved communities have been found, work begins on helping them to establish a safe source of water. In all projects, communities take the lead in planning, managing and paying for the work. In this village, WaterAid and its partner organisation have provided the drilling rig and an engineer. The villagers have contributed labour and building materials. Many communities have shallow, open wells. WaterAid is deepening these so that they provide water during the long, dry season. They're also being sealed to reduce contamination. Hand in hand with the well construction programme is hygiene education. Observing how people use water is a key part of WaterAid's work in combating the spread of diseases through poor hygiene.
When we are at the water point, when women or men or children are drawing water, we would like to also understand the hygiene practices that are there. Sometimes you find them dipping their fingers into the buckets. Sometimes you see kids touching the water that's coming out from the spout. Sometimes you see women and men taking sand and putting inside the container if the container's got a hole and all those things. And then we follow them up to understand how they keep the water that they've collected and try to understand, some hygiene practices, whether water is covered or not. And also try to understand, what times are critical for the households to wash their hands, if they wash their hands at all. And we also want them to demonstrate how they wash their hands and what do they use. Do they use ash? Do they use soap? That's basically what we try to understand.
These water user surveys reveal a number of critical hygiene issues, such as the importance of washing hands after using the latrine, that can often get overlooked. In the north of Malawi is Mbangweni, a poor farming community that has grown up around a Victorian missionary hospital. Each morning, staff and patients join together to pray for a healthy future for themselves and their families. Water in Mbangweni is not in short supply. The development programme here focuses on sanitation. Thanks to WaterAid and its partner organisation, ecological latrine building is a growth industry. Eco-sand latrines, made locally out of concrete, replace old makeshift wooden platforms that were dangerous and unhygienic. Underneath the domed slab is a pit. Each time the latrine is used, earth and ashes are added, which mixes with the excrement and decomposes into a rich, organic compost. When the pit is full, the latrine is covered and left to allow the pathogens to die off. Seven months later, the compost is ready. What comes out is a safe organic fertiliser that can be used on the crops. For the Kacheche family in Mbangweni, the eco-sand latrine has been a great benefit.
Wanu, vimbuzi va eco-sand kuvitema vanovwira kupanda makuni aunga mafruits. Eco-sand yanuvwiraso pakugima chintorera nyengo yayi panyange ngagima kwa kuchepera wana wala na mara materials yake ngapusu nukatema so makuni yayi tora wakasirabu gima khulu kuikapo panga ka fence panyengo ichoko nugwirisika njito kweniso vinganipasa songozi cha olo vindanipe ngozi yakuti panyi kwaitika kuti mabira chindu maini chivendo olu mwana adanionekereta.
And Patrick's daughter Lillian no longer fears using the latrine.
Mutema simbu zakasinda sinda chifukwa chikweka kumala makuni kweniso patatema simbu zakale patatema simbu zakale vana vanyango zinaiko panganga ngozi.
The introduction of the eco-sand latrine is transforming the environment of many villages in Mbangweni.
In a word that I got from our community, which had good access to ecological sanitation, they said, before they started supporting us, the surroundings here, used to stink. You just wouldn't go outside your village without following the proper footpath. Otherwise, you'd trample your bare foot on fecal matter. And then they would also say, we would sit in the shade within our houses, and the wind would blow towards us, and all we would have is a stench of fecal matter. But the situation now has changed in our village because of support that we have received from WaterAid.
The key to EcoSand's success is the free fertiliser that farmers can now use on their crops. Tobacco farmer Henry Chikanga Nkoma is keen to show boys how well his crops have grown since he's been using the EcoSand fertiliser.
What he's actually doing here is applying compost fertilizer to his tobacco crop. He has excavated this compost fertilizer from his EcoSand latrine. As you can see, Henley has just been telling me that his tobacco crop is doing quite well with this compost fertilizer, which he has excavated from his latrine.
WaterAid has been working in Malawi for only a short time, yet much has already been achieved. Last year in the Salima district alone, WaterAid installed 77 hand pumps and 619 EcoSand latrines. Hygiene education is enabling communities to lead healthier, longer lives, while the innovative methods of mapping water points confirms the value of WaterAid's advocacy work at a national and international level. But for Boyce, the greatest pleasure comes from seeing a community transformed by the provision of clean, potable water.
You can actually look back from a community that was getting water from stagnant scoop holes to have access to potable water, and you are part of that process. That is quite exciting. I really enjoy my work, and I'm looking forward to working with WaterAid in these coming years.
Kuchokera kuno ku Malawi tifuna tinene kuti zikomo kwambiri kwa inu nonse potithandiza. From Malawi, we would like to say thank you so much for assisting us improve access to potable water and effective sanitation to the rural masses of our country. You are doing quite a wonderful job, and I would like to say thank you so much for helping us in Malawi. WaterAid Malawi is making a difference in the lives of the rural poor. So thank you so much, all of you, for your support and your efforts. Thank you so much.